South Africa will have the 10th highest level of child obesity by 2030, affecting about 4.1 million children and teenagers between the ages of 5 and 19. That grim prediction from the Health Living Alliance, which is pushing for an increase on the health promotion levy, known also as the sugar beverages tax, to assist in curbing obesity. It says being overweight is one of the top 5 risk factors for premature death and disability. For more on this now, on what we should be doing, let's bring in the head of the Health Living Alliance, that's Lawrence Mbalati, who joins us now via our video link. Lawrence, thanks very much for your time and welcome to the program. Perhaps let's begin with the global context insofar as obesity is concerned. My understanding is that this causes more premature deaths in some instances than road fatalities.
Certainly, Ayanda, and good morning to Newsroom Africa viewers. Yes, indeed, we are dealing with an epidemic because, the obesity itself, it's a disease, but also it's a predator condition for risk to a variety of non-communicable diseases, including diabetes, hypertension, and cardiovascular disease, and some form of cancer. So we're dealing with a huge epidemic globally, and the World Obesity Federation today has released a report that shows that countries with a 50-plus adult population living with overweight or obesity have seen more severe cases of COVID-19 and death, South Africa included.
And the perceptions out there mostly is that people who are obese are in that situation because of a lack of exercise or just bad diet. But this is not the full picture, is it?
That's not the full picture.
Yeah.
So if you look at the obesity epidemic, what drives the epidemic basically is a broad range of issues. So the commodifying of the food environment, for example. In the last 25 years in South Africa, you have seen a huge market of highly processed food, which include food with high content of sugar, salt, and saturated fat. So this commodifying, right, and the microeconomic policies that has driven the market of bringing, cheaper, unhealthy, food into the market has grown, to a point with a vigorous marketing that me and you, it's difficult, to resist being tempted into testing or snacking the most unhealthy food in society.
There's also talk of a lack of sleep being able to contribute to obesity. Not many people would make that association. Tell us a bit more about that.
So, obesity is a societal issue.
Yeah.
So mental health will come into, gender will come into. If you look at the proportion in South Africa, more women are living with obesity, 58%. So general population, we're at over 50%, with 37% of men. So if you look at it, the pattern, it's a societal problem. So issues like mental health, you're talking about lack of sleep, you're talking about, unhealthy eating habits and what leads to that. There are a lot of contributing factors that are associated with obesity, but diet is at the center of it, and diet that has excess amount of sugar, saturated fat, and salt.
So that's the prognosis. Part of the solution that you are suggesting as the Healthy Living Alliance is an increase on what's called the sugar beverages tax, not to be conflated with a tax on sugar itself. The question becomes, do we know how effective as a deterrent increasing tax would be on actually changing people's diets?
So that's a very good question. So we know that regulation works. So we have seen with tobacco, the most difficult thing and the resistance, I think, in the regulation of the sugary drinks beverages or the health promotion levies, because not many people are aware of the harms of the sugary drinks. Over and above, excessive consumption of salt, food with salt, and with saturated fat. While in tobacco, we already knew when regulation came, they know the harm of tobacco. So we know that it works. There are 2 studies that are done that are showing that since the 1 year since the health promotion level sugar drinks tax was implemented, it has actually slashed consumption in the 2 townships, one in the Western Cape, Langa, and the 60% reduction on self-reporting in Soweto. So we know that the tax works, and in the long run, we know that reduction in the consumption of excessive sugar, salt, and saturated fat will reduce obesity, which is a predictor for diabetes, for hypertension, and cardiovascular disease, and some form of cancer, as we have seen the huge increase and the epidemic that we are sitting on, Ayanda, at the moment in the country.
Right. I mean, you mentioned that obesity is a societal issue. I wonder what the obesity levels are across the class divide. Are you finding that the more money people have, the less likely they are to become obese, or the inverse?
So that's a very good question. So, for example, even the highly processed food, the market for highly processed food, it's actually targeted on the poor. So the policy for that we are pushing for on the doubling up of the sugar drinks tax is just exactly for that, because I think the narrative that the industry is bringing is that bringing taxes on unhealthy product is anti-poor. But we know it's pro-poor, making cheap, unhealthy products available in society. The poor are most at risk and more vulnerable to consume such. So that's why taxes are one of the most effective mechanisms to make sure that, there can be less access to unhealthy. And we need, as I've said, it's a societal issue, a multi-sectoral approach that can look, making a healthy food accessible, available, affordable, that can ensure that it incentivizes healthy eating and the health promotion, and making sure that people can access nutritious food as a way, of predetermining and actually addressing the scourge of obesity in this country.
Yeah. I mean, Lawrence, you're the expert, but from my shallow pool of knowledge, I'd deduce that obesity or fighting obesity also involves a lot of a psychological game. I wonder how much things like stigma around this disease makes it difficult for people to psychologically pull themselves out of being in a situation like this.
Yeah, so that's actually a very critical issue, because we're living in society that can be body shaming, right? If I have a big body structure, people can conclude and assume that I'm obese. Like I've said, obese is a condition, so it's measured by a body mass index. So it's important that we understand that, if someone is obese, it's actually a condition. It's a disease on its own right. So we cannot always assume that if someone has a huge body structure, and I think self-blaming is a big issue, right? That, you are obese because you eat a lot, you are obese because you don't exercise, and so on. We know it's deeper than that. People don't have access to healthy alternatives, and so on.
Lawrence, if I can just interrupt you there, apologies. There's a developing story we need to focus on, but I think your point is well made. Lawrence Mbalati is the program manager for Healthy Living Alliance.